Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to KOCT Community Health Matters. Today we will learn more about Vista Community Clinic, known here in San Diego North County for its commitment to make affordable, high-quality health services available to all patients, regardless of how much money they make or their insurance status. My guest today is Fernando Sanudo, Chief Executive Officer of VCC. Fernando has been with VCC in various capacities for almost 3 decades. He became the CEO in 2013. Fernando, welcome to KOCT Community Health Matters.
Thank you.
Would you please give us just a brief history of VCC?
Sure, I'm happy to. Vista Community Clinic actually started around in the early 70s. And it was started by a group of volunteer doctors and nurses who became concerned because there was many residents in the city of Vista that did not have health insurance or access to health care services. So as time went on, the need continued to grow until these doctors and nurses realized that they needed to have a formal building or somewhere where they could provide services to those patients. And so the handful of doctors and nurses and volunteers were able to get some space from the city. And it was actually the space that was used for the local dog pound. So we generally tell people that Vista Community Clinic actually started at the local dog pound. Many years later, after Barbara Bonino, my predecessor, who was with the clinic for 30 years, so many years later, we have now over 560 employees.
Wow.
We have 6 clinic facilities, 2 in the city of Vista, 3 in the city of Oceanside, and then our newest clinic is actually in the city of Lake Elsinore in the county of Riverside.
Marvelous, marvelous. You've been growing steadily then.
Yes.
How has it grown over the decades to become a leader in healthcare in North San Diego County?
Well, I can honestly say, being the CEO of Vista Community Clinic, that there's many, many reasons why Vista Community Clinic is considered a leader in the healthcare sector. The number one reason I'd like to think that we're a leader is that we've been able to show that we have improved the healthcare outcomes of many of our patients. For example, we've been able to reduce the sugar level for many of our patients who have chronic diabetes. Mm-hmm. We've reduced blood pressure levels among our patients with cardiovascular diseases. And then we've also increased greatly the access to both mental health therapists and psychiatrists for our patients who have been diagnosed with chronic depression. So for those reasons and many more, I'm very proud to be part of this community clinic and know that we've been able to improve the health care of our patients.
So along with the medical services, VCC is known for its many innovative health education programs. Can you talk about some of the programs and that you're doing to educate the community and making sure that the residents get the information that they need for these important health issues?
Sure. So before I talk about our great community services or wellness services, I'd like to point out that Vista Community Clinic has an array of medical services. Okay. We provide prenatal care. We have an incredible women's center. We have great pediatricians on site. We also have an adolescent clinic for teens. We provide, we have dedicated doctors who work with our adult patients and then our senior patients as well. So in addition to the medical services, we also provide dental care. Okay. We have mental health with access to psychiatry. Most recently, we've added optometry and chiropractic services, which we're very excited about. And then the clinic also has a pharmacy on site and we provide transportation for those patients that need it. So our community wellness center is made up of a variety of different programs. The focus that we have with our community health is we provide breast cancer screening and education and outreach. We have programs that are focused on maternal and child health education. We have programs focused on our local farm workers because they are a part of our community. And then we have programs that look at HIV testing, education, and screening. And then to add to a couple more, we have a couple programs that actually focus on reducing access to alcohol and tobacco products for our adolescent. And then our most popular program is Project Reach, which is an after-school program that focuses on recreation, employment readiness, academics, communication, and healthy lifestyles among our at-risk adolescents.
Wow, that sounds like an extensive program. So what are some of the innovations in recent years that you have brought on to improve services to patients, and how are you helping them access those services?
So our innovation, I'd like to think that like any healthcare institution or any top-notch healthcare institution, our physicians, our nurse practitioners, our physician assistants stay on top of any new research on medications or any medical services. And we want to make sure that we're providing cutting-edge medical services to our patients because we want our patients to get the best possible care. In addition to that, the clinic has been involved in research projects, research around diabetes. What are some of the best education methodologies to educate our patients around diabetes? We've looked at research around childhood obesity. And then we've done some extensive research around our farm worker community. And in fact, we're one of the leaders in that respect and one of the very few agencies and organizations that actually do research with this population.
Can you briefly share with us what's in the future for VCC within the next 5 years?
What's in the future? A lot of things, but I think three things that stand out for me is I want to make sure that we continue to improve the healthcare outcomes of our patients that have been diagnosed with chronic health conditions. We'd also like to be able to bring in more specialty services to the clinic so that our patients don't have to go outside of the clinic for their services. And then finally, we want to continue to be the healthcare center of choice for our existing patients or any new patients who currently have not chosen a medical home.
Thank you. Up next, after a short break, we will have Dr. Orna Gill, Director of Gynecology at VCC.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Welcome back. I would like to welcome Dr. Orna Gill, Director of Women's Health at VCC. Dr. Gill is well known for treating a variety of gynecological conditions with minimally invasive robotic surgery. Welcome, Dr. Gill.
Thank you.
Please give us an overview of OBGYN care provided at VCC.
So The program that we have at VCC is very comprehensive. It includes the great gamut of prenatal care, which starts at low risk and goes to high risk. And we're very proud of our partnerships with UCSD and San Diego Perinatal, where we're able to work with them on the highest risk patients. We also have comprehensive gynecological services that include clinic surgery, basic GYN, as I said, outpatient clinic procedures, and then inpatient care at Tri-City Hospital. We deliver babies there, and then we also do the entire range of surgeries, both from conventional all the way to the most complex robotic.
So you're well known for your expertise in robotic surgery. How does robotic surgery differ from conventional surgery?
So robotic surgery is a technique that employs a robot as an assistant instead of a person. I mean, there's a person who assists, but in addition to that, the robot allows you to have more access to parts of the body that are more difficult to get to with camera surgery. Conventional surgery makes a big cut. Camera surgery with robotic assist, little tiny poke holes, I like to call it, or ports, which is nice from a cosmetic point of view. And also, robotic surgery provides advantages to the surgeon because we're able to do very complex cases without making large cuts, which exposes you to infection, bleeding. From a patient point of view, you can spring back to work and to family care much, much sooner, in half the time.
Okay. So what are some of the most common women's health conditions that can be treated with robotic surgery?
Good question. So the most common is fibroid uterus, heavy bleeding, that is not amenable to medical intervention. Then also, we remove pelvic masses, the ovaries can come out, any kind of reconstructive work that needs to be done in the pelvis is also accomplishable with a robot. The beauty of it is the most complex cases with, let's say, a lot of scar tissue in the abdomen, from, let's say, C-sections, other abdominal surgeries, we can overcome those challenges with the robot, whereas with laparoscopy, it's much more cumbersome.
Okay. So, and some of the advantages of robotic surgery, I think you've mentioned some, but are there additional advantages?
Well, it's really nice because the costs are very similar from just on a practical level. And again, the recovery time for patients, very, very quick. 2 weeks sometimes for major surgeries. Exposure to bleeding, much less. Exposure to infection, much less, because you don't have these massive cuts. And also you need less personnel, and less stress on the hospital staff and resources, and that's something that we're always aware of with the emerging public access to health care.
How do you determine whether or not a patient is a candidate for robotic surgery?
Another good question. So there are very few people who don't qualify. Okay. I would say the main reason you would say a robotic surgery is unlikely to succeed, or if you predict a conversion to open, is the size of the mass. Some people have very, very advanced pathology, where the uterus goes all the way up here, or the pelvic mass goes all the way up here, right underneath the diaphragm. So there's no room to put your ports and instruments. So you really do have to make a cut. That would be a limiting factor. Another limiting factor would be severe cardiac or pulmonary disease, because we do tilt you toward your head, and so if your body can't tolerate that, that would probably be not advisable. But our anesthesiologists are amazing at Tri-City, and they truly do know their way around these kinds of problems.
And your patients, how do they respond after they've had the surgeries?
Oh, they are so happy. The great thing is that now I'm able to offer what's called single site robotic surgery. So not just these little poke holes, so that's one thing that is cosmetically acceptable, but consider no holes at all, and the whole surgery done through the belly button. We put the whole robot in there, and operate that way. And when we close, there's no visible scars at all. So that's another, I forgot to tell you about that one, but I'm glad to be able to tell you, another option for patients and another advantage from a cosmetic point of view.
Is to have that the robotic surgery done through the belly button.
That's right, the only incision.
Thank you, Dr. Gill, for educating us on this fascinating subject. When we come back, we will learn more about prenatal care that VCC provides expectant mothers.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
Alvin and the Chipmunks want to remind you, bacteria can hide in food and make you ill.
Wow.
But you can keep bacteria from ruining your day with 4 simple steps. Clean.
I'm waiting for the rinse cycle.
Separate. Cook.
Fire in the hole!
And chill.
We chipmunks are notoriously tidy.
Check your steps. The road trip to food safety starts at foodsafety.gov.
You're doing great. We're gonna try this again, okay?
Okay.
Wheels, pedals, handlebar, brakes. Sit up straight, keep your weight in the center, keep your eyes on the road, hands on the grips, button the seat. If we feel ourselves falling, what do?
Just keep
pedaling. Good girl. Now remember, it's all about balance and steering. Steer with your hands, steer with your body. Steer into the corners when you stay out of trouble. And the bell's your buddy, so go ahead and ding that. All right, you ready? Here we go. Pedal, honey, pedal. There you go, you're a bike rider.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back to the show. I would like to welcome Dr. Lisa Leonard and Teresa Halverson to KOCT Community Health Matters. Dr. Leonard is an obstetrician and director of obstetrics at VCC. Teresa is the manager of the VCC Women's Health Center. Welcome, ladies. Dr. Leonard, VCC is known for high-quality prenatal care that you provide to expectant mothers. You guys do a really wonderful job. Please tell us how you help women have healthy pregnancies and healthy babies.
Thank you, Raye, for inviting us here today. I am really proud of being a part of so many healthcare professionals on our team that are both committed and really passionate about wanting to provide best care to baby and mom. And prenatal care does make a big difference in terms of ensuring healthy pregnancies. From the time a woman first discovers she's pregnant, we provide the education, the lab tests, the ultrasounds, and especially the ongoing visits on the part of all of us, the educators, the dietitians, the physician's assistants, and the physicians, that we all sort of work together to do that. And thereby really sort of we're able to pick up on any potential risks or complications throughout the pregnancy, to identify and to actually assess from early on the gestational age, and to treat mom for any sorts of ongoing medical conditions that she has or the kinds of things that can come up during pregnancy, and to follow baby both by following the fetal heart rate, the size of the uterus, the size of the baby throughout the pregnancy, but also provide more specialized antenatal care to the moms with higher risk pregnancies. We do work with a large team of specialists as well, that both in high risk and other problems that we can work with during the pregnancy. And then also at the hospital, we are on call and available 24/7. One of the obstetricians is always there. So even before labor and delivery, if a mom has problems during the pregnancy that require hospital evaluation, we're there for that too.
And that hospital is?
Tri-City Medical Center.
Okay, Tri-City Medical Center. That's wonderful. So at what stage in her pregnancy should a woman seek prenatal care?
Well, we actually love it if she comes in before she conceives for preconceptual counseling even, or just woman exam, so that basically if she herself has ongoing medical conditions, we can get those under the best control possible before she conceives, to start her on prenatal vitamins, to adjust medications that maybe we don't want her to be on before she gets pregnant. If we miss that, just as soon as she finds out she's pregnant, we'd like her to come in. Because often too, it's very exciting when a woman finds out she's pregnant, but it can be very frightening. Right. And I think even that reassurance and education is what's kind of critical in helping her take the best care of herself and her baby.
Wonderful, wonderful. So how does the lack of good and timely prenatal care affect the pregnant mother and her developing baby?
Well, undiagnosed and untreated conditions, both for mom and baby, can greatly increase the risks and complications during the pregnancy and the stillbirth rate, all those things. And so, being able to diagnose even any fetal conditions, sometimes those can be treated during the pregnancy, or at least for the whole team to be prepared at the time of delivery. And then for mom, there can be, some increased risks that occur, and medical conditions that are brought out once she becomes pregnant that we didn't know about before, as well as things that can happen to her. Even in the healthiest, most uncomplicated pregnancy, there can be, a great benefit, I think, to providing reassurance to the mom and to her family, so that it, gives her the emotional support that helps her prepare for baby.
Okay,
yeah,
wonderful. Teresa, tell our viewers about the other services that VCC offers to support a healthy pregnancy.
So as Dr. Leonard touched on, everyone really works very well together as a team. So we have registered dietitians, we have social workers, we have childbirth educators, we have prenatal educators, and then we also have lactation consultants that all work together to ensure mom and baby are healthy. If we have a mom with gestational diabetes, for example, the provider and the nutritionist work together to figure out the best care plan for the mom. If, maybe something's going on, maybe mom's in denial about the diagnosis, now the social worker steps in. Maybe it looks like the gestational diabetes is going to affect the birth. Now the childbirth educator steps in, and everybody just works together as a team. Healthy mom, healthy baby. That's our end goal.
All right, wonderful. Yeah. So a new mother often needs information and support on caring for herself and a newborn. How do you help that new mother within the first weeks of the birth of the baby?
So one of the things that we do is we send prenatal assistants to the hospital 7 days a week to help schedule those appointments with those moms. We make sure that they have upcoming appointments with a nutritionist, with a lactation consultant, with an educator. We make sure that they have the appropriate phone numbers that they can call to get help 24 hours a day. And then we're there for them through that postpartum period. They can call at any time and we'll answer whatever questions they have.
Thank you, Dr. Leonard and Teresa, for being my guests today. This concludes this edition of Community Health Matters. Thank you for joining us.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.